6:06 this morning with the latest changes to the vaccine eligibility and the current mask mandate on the line. We know folks have a lot of questions about all of this morning. So we're joined by Dr. Matt Anderson of UW Health. He's live this morning with us. Good morning, doctor. Thanks for being with us. And before we get to some Wisconsin news, I want to ask you, crossing the wires this morning in the last few minutes, Pfizer saying that its COVID-19 vaccine is safe and strong and effective in teens as young as 12. This could be a game changer when it comes to schools.
Yeah, I saw that as well this morning. I think that's great news that we could hopefully Pfizer's going to be moving forward with an EUA request to the FDA in the coming weeks or months. And because it's going to be important to reduce transmission, we know that those teens are an important age group for that. And so getting more shots in arms will definitely be good for that population, getting people back in school as well.
And Dr. Anderson, now here everyone's waiting to see what the Wisconsin Supreme Court is going to rule with the state's mask mandate. As you look at this issue and kind of where we are right now in the pandemic, just curious to hear what your thoughts are moving forward.
I think irrespective of whether there's a mandate or not, I think there's a lot of good medical evidence that suggests that masking in public spaces and in those places where the CDC has outlined related to vaccinated, unvaccinated interactions is important. It's important as a sign of respect that we give to other people, knowing that we could potentially unintentionally be transmitting the virus or at risk of transmitting the virus. So thinking continuing to follow those public health guidelines and masking for the time being, whether there's a mandate or not, is important.
Doctor, let's talk about vaccines. And one of the interesting things as we move into this more eligibility for folks here in our state, just yesterday, this county of Kenosha tweeted out a picture of empty lines and telling people they could accept walk-in patients right now for the vaccine. Are we looking at vaccine hesitancy right now? Because there seems to be at some points more vaccine available than people lining up to take it.
I think there's variability there. That experience definitely hasn't been ours here in Dane County and with UW Health, but we know that that's the case in certain places, perhaps around other parts of Dane County or Kenosha or otherwise. So I do think that hesitancy is going to become more and more of a noticeable issue in the coming weeks. I think we've had very motivated people wanting to get more scarce vaccine as supply increases and eligibility increases. At some point, we're going to come up against that ceiling, and we're going to have to continue to educate, answer questions, provide information and convenience, because we're all dependent upon getting higher vaccination rates to get back to normal in the way that we want to.
All right, Dr. Anderson, thank you so much for joining us this morning. Well, you can track Wisconsin's vaccine rollout at tmj4.com/vaccine.